COVID-19, and on this 100th day of the pandemic, more areas of Ontario are entering stage 2 of reopening. Restaurants and bars will offer outdoor seating and dining. People can get their hair cut, and pools and, for the kids, splash pools will open. But 3 key regions of Ontario with a collective population of more than 4 million will remain in stage 1 for the time being. It's the City of Toronto, neighbouring Peel region, and Windsor, Essex, by the U.S. border. There's a live shot of Windsor. The city is part of a health region in southwestern Ontario that encompasses both the municipality and rural areas of Essex, where several migrant farm workers have seasonal jobs. A big reason that the region is not moving to the next reopening phase today has to do with COVID-19 outbreaks among those migrants at a number of agricultural workplaces. So I'm joined now by the Mayor of Windsor, Drew Dilkens. Mayor, thanks for joining us. I really appreciate your time. Let's talk about growing concern in Windsor over temporary foreign workers doing agricultural work and what that situation has put the community in.
Yeah, good morning, John. Listen, we need the temporary foreign workers to be here. We fought for them in the heart of the pandemic to be able to come here and have an exemption to cross the border into Canada. When they came, they self-isolated for 2 weeks. And now what we're seeing is all of the folks in my community have done exactly what's been asked of them for the last 3 months. They've isolated, they've washed their hands, they've kept distance. And our numbers are really good in the city proper. But as you said, out in the county, we see an explosion amongst the migrant farm worker population. And so the issue is really trying to get our arms around how to deal with that population. And we're talking about 8,000 workers. There's some indication that up to 2,000 could be actually here illegally. So they may have a predisposition to not want to integrate with the normal health system, and they want to be away from sort of the government eyes or the government system. But at the end of the day, our entire region is being held back by one discrete population, and we need support from the federal government, from the provincial government, to get our arms around a strategy on how to deal with this so we can all move forward.
Many have pointed to other areas of the country where temporary foreign workers have come in and pointed to their living conditions, for example. People living very close by, very hard to maintain, and even working close by with one another. Is that something that you can advocate for to try to improve the situation?
Well, we're no doubt that is part of the problem. And so when you have a lot of people living in very tight living quarters in these bunkhouses, sharing common kitchens, sharing common washrooms, and very, very close to one another on a daily basis, there's no doubt that we all know that that's a spread or a vector for spread of COVID-19. And so that is certainly on the federal government radar. I read that in the Globe and Mail this morning. The Minister of Employment is looking at that. But what we really need is some form of testing. And so we say mandatory testing of the farm workers. We know we can't force people to take a test, but much like they're doing in Ontario with long-term care homes, where they're saying you can go visit someone in long-term care, but you have to prove that you're COVID negative through a test. We can do the same thing on the farm with the farm operators. There's 175 of them down here in Essex County. And if we can't force the workers to get tested, certainly we can mandate that the farm operators, that their workers on their farms who are touching our food supplies can prove that they're COVID negative before they can work on these farms.
So walk me through the logistics of this in terms of what you would like to see done for that particular population and how you would like to, or when you would like your economy to start reopening at the same time, or waiting for that testing, or how would you like to see that play out?
Yeah, I think the plan has to be put in place, and the sooner the better. I mean, we've had an assessment center that's been open to test this discrete portion of the population. It's been voluntary, and very few, less than 10% of the migrant farm worker population has actually come through, and they're being held back. If I'm being completely frank with you, they're being held back by and large by the farm owners who are afraid of losing their workers at a very important time. But the most disturbing part of the conversation is those who've come through on a voluntary basis. The positive rate after the assessment, the positive rate is over 10%, which is about 3 times higher than the general population who are being tested here. So there is no doubt that this is a crisis. The Federal Minister of Health, Patty Hajdu, we had a call yesterday. She indicated this was a crisis and also indicated that she's not against calling in the Public Health Agency of Canada to support in some way. And although I don't know what that means, it could be boots on the ground, because we're talking again about 175 farms, 8,000 workers, and some workers moving between farms. We definitely need support if we're ever going to see our region move forward.
Windsor also in the situation because it is a border community, and that U.S. border remains closed, will be for another month, at least so far. Don't know about a further extension beyond that. So even if you were to move to stage 2, you're still somewhat hampered because of the impact that that border and the trade has on your community. Walk us through some of the concerns you have around that.
Yeah, let me just dispel the myth. I don't think the border is the vector for transmission. So I don't see that the fact that the border is closed and that we have essential workers crossing is in any way a material form of transmission of COVID-19. But because of where we live and the geography here, there is no doubt that a city like Detroit is just a natural extension of our backyard. People go for gas and groceries. There are almost 2,000 people who cross from my community to work at healthcare each and every day. And so whether it's Major League Sports, entertainment, shopping, food, gas, groceries, all of those things in Detroit are just part of our backyard. Now, most of that is still closed. You know, shopping has started very, very minimally on the U.S. side, but most of the fun stuff is closed. And so when I look at the trade crossing and the pickup of trucks across the U.S.-Canada border, we are back today at about 80% of our pre-COVID commercial traffic levels. So that's a great sign that manufacturing is picking up on both sides of the border. We see the integration with the automobile economy here in Michigan and Ontario. And so that's a very positive sign. But you know what? The fact that the border is closed for another month for people to cross for sort of casual crossings is probably a good thing. Let Michigan get a better handle on their situation. Let us move to the next stage first. There will be an appropriate time when this makes sense, but I certainly support the closing of the border until the end of July.
Mayor Dilkens, thank you again for your time. Really appreciate it.
Thank you.